Before patients consider weight reduction surgery, they should be asking themselves some key questions. First of all, have I been educated well enough about the anatomy and physiology of the surgery? And have I been educated enough about all the dietary and behavioral changes that are needed, like diet, exercise, stopping smoking? In addition, patients need to ask themselves, am I going to the right program? Because the outcomes can be quite different in one program compared to some other programs. And I would recommend that they go to programs where the patient is educated very well and they have long-term follow-up and the outcomes are good with low complication rates. A general definition for success after weight reduction surgery is greater than 50% of your excess body weight loss. So if someone's ideal body weight is 150 pounds, but they're 100 pounds above that, giving a body weight of 250 pounds, then that 100 pounds of excess weight is the excess body weight. And if you lose at least 50% of that excess body weight, that would be considered a success. It's the motivated and compliant patient who can expect to have the best results that are long-lasting. In other words, surgery is not a cure, it's only a tool. And the patients who use the tool correctly and maintain the tool well over the long term have the best outcomes. So it's a lifetime change. When a patient decides to do the surgery, it's a lifetime change. And that is why we emphasize preoperative education to each and every patient. They have to understand very well what exactly the commitment is, and they need to keep that commitment for the long term. So prior to surgery, it is the education. During surgery, it is the technique resulting in the lowest complication rate. And in the long term, it is the follow-up and continued surveillance regarding the education that we offer lifelong. Most of our success has been documented at the National Centers of Excellence, that is run by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. In fact, we very recently got our report from the previous calendar year comparing our program outcomes, that is complications, compared to the National Centers of Excellence in the rest of the country. And for the 95 gastric bypass operations performed in our program over the past 1 year, we got a score of exemplary in majority of their parameters. So that puts our program amongst the cream of the best programs in the country.